Thank you all and welcome to our webinar, Unlocking Digital Health Adoption. I'm Dr. Sarah Hallberg, Medical Director here at Virta, and I'll be your moderator today. Telemedicine is booming, but many still see it as exclusive to the Silicon Valley bubble. The typical digital health consumer is often painted as an Apple Watch loving, middle-aged, high-income earner. But early adopters in rural America, are proving otherwise. A growing number of success stories are showing tremendous untapped potential for digital health's impact in rural communities. 1 year ago, the Mashantucket Pequot Tribe embarked on a journey to reverse diabetes in their community. What seemed like an impossible journey, given the disproportionately high prevalence of type 2 diabetes in Native Americans, turned out to be a groundbreaking success. While other diabetes solutions have failed to make any sizable impact in this population, they were able to see transformative success with Virta. In case study format, we will examine the building blocks of this partnership and how Mashantucket Pequot was able to unlock digital health adoption and reverse diabetes in their population. We're delighted to welcome an esteemed panel of special guests. Dr. Setu Vora, the Chief Medical Officer of Pequot Healthcare, Trent Myers, the Vice President of Sales and Alliances at Virta, and Heather, Virta patient and employee of the Mashantucket Pequot Tribal Nation. With that, I'll hand it over to Trent to share more context on our partnership.
Thank you, Dr. Hallberg. I really appreciate the introduction. First of all, this is a really hot topic and it's a really hard one to solve. So I love the title. And at Virta, we talk about two bosses, and one boss is our patient and those specific patient care models that we have. And the second one is our unique clients and the specifics around every one of them. And it's really important for us to understand those so that we can better serve the clients. And I'm excited today that we really get to spend the bulk of the time talking to both. So we're going to have an interview with the Chief Medical Officer for Pequot Healthcare, Dr. Vora, and then we're going to hear a patient testimonial from someone in the program, but we're going to be referencing the Virta solution. So I'm going to take literally 2 minutes for those of you that don't have a baseline to describe what that is. So if you'll advance the slide, thank you. It's these 3 points. And I want to talk about the first one, which is clinically proven to reverse type 2 diabetes. That is a strong statement. And I thought what I would do is define Virta's definition of reversal. So it's two things. It's reducing the patient's A1C level to a subdiabetic level, regardless of where they start. So that's below 6.5, while reducing all diabetic medicines during that process. So that's our definition of reversal and what we try to achieve with every patient in the program. I'll describe how it's done on the next slide, but we also have a unique go-to-market model that we feel like it's easier for people to adopt, and that we put 100% fees at risk based on clinical outcomes. And so we have one on RX reduction, we have one on A1C reduction in the population, and we have one on weight loss. So the 3 things the CDC attributes to metabolic health. Now, how Virta works in one slide, and I don't mean to slight this with speed, but I just want to make sure we spend the time with our customer and with our patient. It's really 4 things that work in concert to make this happen. So it's technology to connect the patient to our care model. And we use AI also to prioritize machine learning on who we deal with first based on need. The second is physician care, We titrate medications down as blood sugar comes under control. We have health coaches. And so those health coaches, I would imagine it's what we typically hear the most about from our patient testimonials. It's daily interaction to help keep that individual patient on track. And then we have a nutrition protocol. And that nutrition protocol is based on carbohydrate restriction, as cited in American Diabetes Standards of Care for the last 3 years as a first-line therapy for type 2 diabetes. But it is not a one-size-fits-all, as you'll hear when we talk about social determinants of health or religious preferences or where people live. We take all those into account to really put a personalized plan in for the specific patient, with the goal being after the Virta treatment is over, that they can sustain this for a life-changing period of time. So that's it in a nutshell. And what I thought I would do is then introduce really what we're here to talk about today, and that's Mashantucket Pequot Tribal Nation. And for those of you that may not be familiar, it is an Indian reservation in southeastern Connecticut. It provides benefits to over 7,000 folks, and it's one of the largest employers in Connecticut. We've had a 2-year relationship now with MPTN, if we use that abbreviation, just so that I don't mess up the name. And so we have some results that we can share, and I'm going to ask that Dr. Vora, in the spirit of our conversation, give his perspective on some of those key outcomes specific to the tribe. So to get us started, Dr. Vora, first of all, it's a pleasure to talk with you and interview you today. But to get us going and to start the conversation, help set the context for the audience, the history of type 2 diabetes, and how big of a problem is it or was it for MPTN specifically?
Thank you, Trent. Thank you for that question. Hello, everyone. As most of you know, Native American tribal sovereign nations have existed on the Turtle Island for over 10,000 years and longer. And I happen to serve one such federally recognized sovereign tribal nation, the Mashantucket Pequot Tribal Nation in Southeast Connecticut, as Trent mentioned. The burden of chronic diseases, especially that of type 2 diabetes, is especially high in Native indigenous communities, not just at Mashantucket, but also across other tribal nations in what we call Indian country. By some accounts, the prevalence of obesity is almost 40% and rising. And by various different studies, including a really fantastic reference that I would encourage all of our viewers to look up, the Strong Heart study that really evaluated population health of Native Americans. By some accounts, the prevalence of type 2 diabetes is as high as 16 to 18%. 1 out of 6 adult, a Native American person, is likely to be living with diabetes. According to the CDC, 1 out of 2 Native kids born in the year 2000 is likely to develop diabetes in their lifetime. Staggering numbers, unless we take charge and make some systemic changes. That pandemic throughout Native country is going to be here with us.
So I appreciate that. And we've dedicated our entire mission around that epidemic, as you described, that continues, unfortunately, to get worse over time. And one of the things, Dr. Vora, we've had a chance to visit, and you had mentioned social determinants of health, and it really ties into the title of the program today. The social determinants of health made it challenging to tackle type 2 diabetes within the tribal nation. Can you talk a little bit more about that?
Sure thing. As most of the viewers and listeners know, the social determinants of health, such as secure housing, transportation, access to stable supply of nutrient food, job. Essentially those are the terms that we use to describe poverty in other ways as well. And that seems to be one of the main reason where people do not have access to the right type of nutrients that we would normally associate healthful living with. They have easy access to sugar sweetened beverages and other highly processed food that we know contribute to increased risk of weight gain, obesity, and resultant insulin resistance. This is in the setting of, we have to look at this really rising epidemic throughout Indian country through the lens of trauma. And what I mean by that is historical and ongoing trauma that these native tribes and tribal nations have endured and continue to endure results in significant challenges that are manifested in adverse social determinants of health that we just talked about. It results in prevalence of higher mental health conditions such as depression, anxiety. And given those challenges with underlying genetic risk factors as well that are partly due to epigenetics, that creates a perfect storm of multifactorial risk that results in choices of nutrition, reduced activity, resulting in higher risk of type 2 diabetes. Many a times, many of our patients may not necessarily have obesity either, but they still have the insulin resistance with type 2 diabetes. So we look at diabetes as a manifestation of the social condition and not just a medical disease. We do not label someone as diabetic. It is just an individual living with and thriving, hopefully, with diabetes.
I love that you're looking at it that way. And we think about it a lot as we put strategies together. And I think later on, I'll ask you a question, especially where people are located. Sometimes it's a challenge, like how do you communicate the benefits of these programs? So we'll get to that. But as we start to get deeper into the topic, we've had a 2-year relationship, but have you had any history working with diabetes vendors and addressing diabetes before Virta? And can you talk a little bit about that?
Certainly. So as many of you may know, tribes have the ability to either have Indian Health Service administer their health programs directly, or the tribes may opt for self-governance, self-determination, and operate their own health system and health programs. At Mashantucket Pequot Tribal Nation, the Tribal Council, which is our governing body, has always placed health as objective one of the tribe. And in that spirit, the tribe operates the health program through its own tribal health service and offers many really wonderful established programs, such as the special diabetes program for Indians, which, as many of the viewers might know, is one of the shining example of Indian Health Service-led initiative that has resulted in over 50% drop in kidney failure requiring dialysis amongst Native communities. So those are the established programs that we currently operate anyway. Apart from that, we also have looked at having our own medication therapy management pharmacy-led program that is already available as well. We offer disease management one-on-one coaching on site before the pandemic, of course. So in spite of having those high-touch local on-premises program, there was still a big gap in people having access to care the way they wanted it. So we did look around and explored various different emerging technology platforms. And we asked ourselves one question: is this digital solution just nice and easy to look at, or is it really addressing a pressing, chronic, intractable need? And we look at technology only as an enabler to the care teams, where technology essentially should become invisible. And in our search, we looked at various different solutions that were in the marketplace at the time. Not to say that they are not good or valid. They all have their own unique role and niche. What we felt was that there was a desire amongst our people that we serve to have more of a natural way of addressing their health condition. And the affinity towards having food seen as a medicine really spoke to at least the population that we surveyed before embarking on Virta through our collective journey. So again, using that cultural aspect of using food as a medicine, reconnecting with nutrition that, you know, almost has an element of unlearning certain things that we consider a traditional diet. Because Heather and our other colleagues who are native elders and leaders can tell you and tell us that sometimes we consider something as a very traditional food, but that just happens to be traditional in the last 50 to 100 years post-colonial, sometimes driven by lack of food sovereignty anymore, and well-meaning but poorly designed programs that pushed processed flour and lard onto Native American communities. And before you know it, fried bread becomes a staple that we associate as one of the traditional foods, but it may not be truly ancestral native traditional food as well. So with all those type of different considerations, we explored relationship with Virta, and we found that that was a good fit, not just for our tribal members and tribal families, but also for tribes team members. We have many different enterprises, and the Tribal Council has provided for self-funded, fully self-insured health plans for all its employees and dependents. And we see that the global community that includes our team members and dependents also have similar challenges of type 2 diabetes. So the solution that we were designing for our native owners and native population also had equal effectiveness and use for our team members and their families. So we opened it up to both of those subsets of populations.
Well, we're excited that you offered Virta to your population, but I'm also excited that you're investing in a lot of different avenues to address this with your population thoughtfully. So hats off to you. So this is the part of the conversation where I get into my uncomfortable zone, and that Shannon, if you don't mind sharing the slide or advancing a slide so the audience can see. One of the things that we do with clients that we talk to with everybody, and I'm very comfortable about, is talking about outcomes. And we look at things like population shift. We look at drug reduction. We look at A1C drop. And over time, we can use your specific data to analyze those trends. And since we've been together 2 years, I want to share some of these. And the reason it's uncomfortable is I'm not a medical doctor, and typically we have one of ours walk through these with our clients. But since you are, and you represent, the company, I would love your perspective looking at these particular slides. And if you don't mind commenting on this first one, which is the population shift by category.
Sure thing. So the initial phase of our Virta rollout was predominantly limited to individuals who are living with diabetes, and they are currently on treatment as well. And obviously the most benefit, the hypothesis was that the more perhaps sicker they are, uncontrolled diabetes they have, and more medication they take, perhaps the positive impact of this medical nutritional therapy will be more obvious in that population. At least that was the hypothesis for me going into this. When we looked at the breakdown of the demographics and the the control level of individuals with diabetes who chose to participate with Virta program, we could see that over 50% were really not well controlled at baseline. And we know that there's an incremental increased risk with each percentage point of A1C going up, that the risk of cardiovascular events, heart attacks, strokes certainly increase. The risk of chronic kidney disease, which may ultimately result in end-stage renal disease and dialysis, goes up. The risk of leg ulceration, peripheral arterial disease, that for unfortunately non-traumatic lower extremity amputation goes up. The risk of sepsis goes up when your diabetes is not controlled. A simple urinary tract infection in people who have A1C above 8, 9, 10 may turn into, full-blown sepsis, resulting in hospitalization, in many cases, even death. We have seen that during the last 1 year, that diabetes seems to be a strong predictor for more severe COVID disease, resulting in hospitalization and even death. So I think it goes without saying that at baseline, the population that enrolled did have a lot of opportunity to improve. And as you can see from this slide, at 1 year recheck, and by the way, these patients get followed with biomarkers closely even throughout the year, all done by Virta's virtual medical team. You can see that it flipped. It switched from 50% being poorly controlled to virtually having almost 60% individuals who reversed their diabetes defined by A1C. And they were off medications except for metformin, which was allowed as a baseline. It's a fairly innocuous, low cost intervention to reverse and maintain insulin resistance. So to have a cohort of patients such as this who are not well controlled to be able to drop almost 2% point, 1.7% A1C, and sustain it over 1 year and going on to year 2, that sustainability of the drop in A1C is even more powerful, because most of us know that a simple 1% drop in A1C to the patient means a lot, because to them, they should know that it reduces their cardiovascular risk by some estimate 45%. So small changes, big result.
You should really be proud of this. And I love all of that detail. And I think just looking at the population shift from 51% to 4%, and then the healthier population going from 18 to a larger group is really, really encouraging to see. So I appreciate you walking us through that. The next slide I had teed up is really to illustrate medication elimination. And, one of the things that I'm surprised and was surprised initially joining Virta, which I'm now not because it's consistent, is how rapidly this drops off and makes an impact. So maybe if you don't mind taking a shot at this slide as well from a medical perspective, what we're looking at.
Certainly. And again, Trent, in this specific graphic, we are limiting our discussion to medication used to control diabetes. And as you could see from this, within the first month or 2 of starting medical nutritional therapy under the guidance of a Virta physician and a Virta registered dietitian and your health coach, majority of our patients had significant drop in their fasting and postprandial sugars, blood glucose levels, enough where the team was able to de-escalate treatment in individuals who were on high dose of Lantus or other longer acting insulin at baseline, or higher doses of medications such as Januvia, Jardiance, and others. There was a clear need to reduce the dose very early in the first 1-2 months. And so much so that it led to 78% elimination of diabetes specific medications, except for metformin. And that's powerful. I think from a patient's perspective, not to have to take high dose of insulin makes a world of a difference. And we'll hear more about that from
Yeah, I'm excited to hear Heather and talking about this. There's a lot of side effects, and it's really nice if you can eliminate the drugs. But on that note, and transitioning to the next one, it's not something that we go to market specifically to solve, but is a byproduct of what we're doing, getting blood sugar under control and reducing medicines and having a new way to use medicine as food, as you described earlier, that we typically see consistently a large amount of weight loss. So if you wouldn't mind addressing this as it relates to Mashantucket Pequot. Dr. Vora, you're on mute. There you go.
Sorry about that. So with the medical nutritional therapy and avoidance of processed starch and sugar, the metabolism really switches into a different gear. And we have expert in Dr. Hallberg, who has led the field in that whole area. And where the body's mechanism to use its own endogenous fats improve, and the visceral fat starts shrinking because that's also being used up as fuel, that approach really results in significant weight loss. And I would say 5% weight loss gives a lot of bang for the buck. So if I see any intervention that results in a 5% sustained weight loss, to me, that's meaningful, both clinically and to the individual's personal patient-reported outcomes. What we saw that is almost 50% of our enrolled members had over 10% weight loss, which is significant. And when you average it out, the average weight loss was 24 pounds per participant in our MPTN Virta program. That's just remarkable.
That is remarkable. And 20 plus pounds is remarkable to anyone. So I appreciate you going through that. The next slide we can talk about, or if you're comfortable with, if you'll advance it. And this is not a business presentation today, nor is it a pitch on Virta. We barely touched on what the program was at the onset, but I typically see an ROI being required to justify the purchase, to offer it as a benefit, to do all the things that we've talked about for the last 25 minutes. And so it's, in its basic sense, it comes from these drugs are really expensive and they come off, and therefore there's savings that's measurable over time. But it's not the reason to offer a program like this. But it is a question that comes up during the cycle. So if you're able to talk about this a little bit and spend a minute, that would be great.
I think, we know diabetes is expensive to the person first and foremost. It changes their life. It changes their lifestyle. It affects their social interaction. It leads to different choices of food, more medication. It is an expensive condition for the person living with diabetes. And at the same step, the health plan that sponsors the health benefit also takes up a lot of the cost, majority of the cost associated with diabetes and its complications. So by some account, even 1% reduction in A1C is equal to avoiding $3,000 worth of healthcare medical cost. And these are mathematical models that perhaps Dr. Hallberg can explain even better. But it's well described that better controlled diabetes downstream results in less healthcare utilization, that is ER visits, hospitalizations, and such other complications that may require even more expensive interventions. So that's just the healthcare expense side. What we looked at, because we at Mashantucket Pequot, the tribe invested in healthcare enterprise even before its other enterprises, including gaming. At Pequot Healthcare, we administer our own health plans. We design our own health plans. We have our own independent third-party administration system. We are a federally licensed pharmacy and a PBM. So it's a full stack of those in one organization. So we look at the individual claim lines, and we looked at our members who enrolled with Virta program, and we looked at their historical healthcare utilization and their pharmacy behavior and spend, and then what happened to that in the year that followed. And this slide illustrates that you start seeing dramatic drop in their cost structure from just pure pharmacy. Forget about the healthcare utilization secondary saving piece, but you start realizing savings in year one. And with year two, the saving is almost 50% reduction in their pharmacy cost because of de-escalation of not just the diabetes medications, but in many cases, other medications as well, such as antihypertensives. So if the CFO is the one who is interested in the program and they want to just look at, hey, we know we heard that this works, but is it sustainable from a financial perspective? I think this confirms that when you do the right thing clinically, the cost saving follows. And we see that even in acute hospital care as well. You provide a good quality, safe, effective, and good patient experience care, your cost structure to deliver that care will be much lower. And that's borne out with our experience here as well.
Well, I appreciate you sharing that. It is something that, benefit leaders that represent companies face often to justify different programs for their population. And I think the point that I'm walking out with is like doing the right thing for the folks can result in significant savings, even conservative pre and post, just on medical savings and cost reduction of these high cost drugs. So we've covered a lot. I have one question that kind of ties into our theme of the webinar, but I mean, just thinking about the conversation so far, we're talking about outcomes specific to the tribe and from a medical perspective. We talked about social determinants of health, which is on everybody's mind now. We talked about cultural norms. We talked about food as medicine. And it's really, really nice to understand your perspective as a chief medical officer. So thank you very much. So last question for you that I was thinking is, were there, if you remember, any critical patient engagement techniques that worked for your population? I would imagine that there could be a decent number that is like remote and not in a place that's like urban central. So maybe your perspective there.
Sure. In terms of engagement, at Mashantucket Pequot, our design team generally includes the beneficiaries early in the decision-making process. And that's exactly what we did when we were vetting our solutions to address the diabetes challenge. What really helped with engagement was to have local champions. So we have a tribal council that is extremely engaged, really progressive, embracing new ways of doing things and not just continuing the same old. And one of the counselors was an early adopter. And when you have leadership walking the walk and talking the talk, and we also have wonderful team members such as Heather really understanding this early on, and then helping other team members and other family members who are curious about it, learn more from example as well. And that word of mouth in Native communities is very powerful. And engagement is, multiplied when you see obvious changes in someone's health and how they appear to external people. Even though appearance is the last thing, most of us worry about. Hopefully, we worry about what's happening inside my cardiovascular system, but it does matter. And I'm curious to see what Heather has to say about engagement.
I am too, and we'll transition there, but I think there's some key takeaways, and it's not, the engagement strategy is not a one solution fits all, and there's cultural norms. And so I'm even learning from that answer that an early adopter within the company or within the tribe that can pontificate and really be a leader to get the word out so a person like Heather even knows about it is really key as we reach people. And that's what we think about every day is how do we reach people? Because it doesn't matter if we're not able to provide the service. But thank you so much for your time, Dr. Vora. I really appreciate you as a customer and you coming on and sharing your perspective from the CMO seat. And thank you very much. And with that, I'll turn it over to our second boss, or she's probably one of my second bosses, Dr. Hallberg, to interview a patient and hear really what it's like from Heather. So with that, I'll turn it over to you, Sarah.
Well, thank you. And thank you, Dr. Vora and Trent. That was a wonderful discussion. And now here's a time that I'm very excited about, which is introducing and welcoming Heather. A little bit about her before we get going. Heather has been working at the Mashantucket Pequot Tribal Nation for 27 years. Heather is a tribal elder of the Narragansett Indian Nation located in Charlestown, Rhode Island. She is a daughter, sister, aunt, wife, mother, and grandmother of 3. So she must have had a great Mother's Day here recently. She is very passionate about storytelling through photography. Heather, we're so grateful that you're here to share your story with us. If you don't mind, I'm going to jump right in with a question. I just have to say also that I love hearing from patients who have been there and who have an experience to tell. And I think that there can be so much learning from listening to patients like you. So I have to thank you once again for taking the time to be here. Tell us a little bit about what your life was like before joining Virta.
I don't even want to think about that anymore, Dr. Hallberg, but it's a good reminder so that I never go back. But life before Virta was introduced into my world, I was living with diabetes for 17 years, and I had almost instantly gone on insulin because of allergic reactions to other forms of treatment. And I was led to the Tribal Health Services doctor, which I utilize and I've utilized my whole life, because I had gone to an eye doctor and I was blurry. I couldn't see. It's like I woke up one morning. It's like my eyes aren't mine. They're not working. And I remember the doctor saying, how long have you been a diabetic? And I said, oh, I'm not. And he goes, I believe you are, and badly not managed. And I remember going and working with the Tribal Health Clinic doctor, and they did a battery of tests and said, okay, you are diabetic. And I remember sitting there and crying, and I'll never forget the doctor. I'll never forget them. They held my hand and said, we're going to get through this together. And that was 17 years ago. And what I knew about diabetes at that time was that once you were diagnosed with diabetes, that was it. It was sort of like a life sentence. I grew up in a family in a tribal community that suffered terribly from diabetes. And I saw firsthand what that meant. And I did everything I was taught to do. Everything. And when I look back at life during those 17 years, what I was taught didn't help me specifically. It didn't help me improve my health. It was a gradual decline of my health, the way that treatment was approached. But it was what we knew, and it was what we were shared. And I worked with a nutritionist, and I've always been very active. I've always been a outdoors girl, sports, activities, a lot of swimming, you name it. And so I kept thinking, how did I get here? You know, I knew about diabetes. We lived a lifestyle, organic lifestyle. My parents farmed. We grew our own food and vegetables, and we worked it. And so that was a shock that I with all of those precautions, still found myself being diagnosed. And I did find that living with diabetes, I'm a very social, outgoing individual, love to be in the middle of action and participating in life. But I found myself gradually withdrawing from a lot of family activities, social activities, because of the stresses that diabetes brings on an individual, and not just me. It would have negative effects on my family as well. I think of events where they were high in excitement, and I would always prepare, make sure you eat right, have a snack in my pocket. But then real life activities, going to a basketball game of one of my children, I'm screaming and cheering like everyone else. I would deplete energy and I'd be going into a dangerous diabetic low, to the point where now a fun family activity turned into a medical event, and sometimes a hospital run, because strangers around me didn't know what was happening or how to help. And I found myself slowly removing my presence in some of these arenas, not to be a burden, and trying to live with this disease and doing everything I could. So for 17 years, it was this rat race of following those treatments that I knew to follow at the time. And that was life before Virta.
Yeah, I mean, very tragic in the sense that, what was happening is you were falling into the usual chronic and progressive, one lane of traffic, if you will, only going one way. And so I'm so glad that you have turned that car around and found the other lane. So that leads into my second question, which was, how did you find out about Virta and what motivated you to join?
Well, I love to tell this part because I work for a company, as you mentioned, for 27 years. And I've been blessed to work for a company and a tribal government that invested in their employees' well-being. That was the first step leading to my new lane. And I remember being at work one day and I was deep in projects and I got a phone call. My brother works for one of the companies that the tribe oversees. And he called and he said, "Hey, have you checked out your emails?" And I said, "No." He goes, "You have to check out your emails. There's an email in there that talks about reversing diabetes." And I was like, "No way, who ever heard of that?" And he goes, "I'm telling you." So instantly I go to my email and there it was. And I'll never forget it. It's like a neon in my mind to this day. Reversing type 2 diabetes. And there was a phone number to call. And I instantly picked up the phone and made that call. I knew nothing about it. I didn't know where it was going to lead or take me, but I knew by that tagline that, and he had said, "You have to call. What do we have to lose?" I said, "I'm calling." And I did. And the onboarding process with Virta was incredible. It was detailed. It was patient. It was informative. We all learn in different ways. And one of the things I always loved and I value, I actually revisit the videos that they shared, explaining how Virta works. And I respect the fact, and I am internally grateful to the research and development that went behind the science. I love science. I don't understand it, but I love to delve into it as much as I can and really grasp that there's more to the just what's on the surface. And I knew that what I was living with and what I had seen my families live with was something that was so complex. We hadn't gotten a real good gist of it yet, but something was about to change. And what opened my mind to just dive in 150% was the fact that an employer made an investment. Virta Health had made an investment many years in earlier through the research and development before bringing it to market. And I said, and if these commitments could be done so that someone like me could regain good health, the quality of life back that I had lost, quality, not quantity, but quality. All I had to do was my part. And I studied, and I was blessed with a health coach, Leah Wakefield. You'd think she was my daughter. I speak her name constantly to everybody and anybody. I can't say it enough. Leah Wakefield. She is my health coach. She is a dear friend. She is so incredibly supportive. And the relationship has grown over 2 years, because in the beginning, I think I needed her every hour. What do I eat now? What do I do? I was shocked when I would eat a meal, I would take insulin, but then my blood sugar didn't rise like I knew it used to. And that even scared me. This is different, And I will say that meeting Leah and meeting my doctor, Frank Dumont, within less than 2 months, I had been on fast-acting insulin and had gotten up to taking it at least 5 times a day, along with 1 shot of a long-acting insulin. So that's 6 injections in a day. In less than 2 months' time, I was off all fast-acting insulin to this day. Never been back on it. It's out of my medical record, my chart. And my long-acting insulin, which was at 60 units at bedtime, imagine that, 60, has decreased to 24.
Great.
And yeah.
So I think you bring up a couple of really important points, is that, when employer provides this, it really builds a sense of trust, I think, to know that they are putting in the care to offer something that's going to be successful to you. So I loved hearing that. And then the other thing is being supported by your community as well. And then you can turn around, of course, in the long term and support other members of the community. And that's how we make great changes, right? In the larger scheme. So at first you can be helped by others, and then you can help even more. And I think that's wonderful. So very exciting to hear. And so my last question is, what has life been like after joining Virta?
I've been given my life, yeah.
Your health and well-being all over.
Yes. I feel like I've been given a new lease on life. Like I was even saying to my husband, I said, how exciting is this? We love all things activity outdoors, and some of those things we lost, and we can actually go for bike rides again. I can go alone and have no fear. I stopped traveling alone. I'd fly out to see my son and grandchildren, and that even became dangerous. I can do that now without fear. My daughter and I used to love to always enter road races. And I stopped doing that and watched. And I was just telling someone the other day, I just got back from seeing my grandchildren after a year of being in a pandemic, and we still are, but during COVID, fully vaccinated. Thank you, Mashantucket Pequot Tribal Nation. And I had a road race with my 8-year-old granddaughter.
Yes.
That was something I wouldn't have been able to do a year and a half ago, 2 years ago. And I sincerely have not squandered this opportunity, this education, this lifestyle change. My granddaughter just turned 8 yesterday, and she was asking me, because during the pandemic, I've gone gray a bit. And she was like, how old are you now? And I told her I'm proud. I used to be ashamed, but I'm 55 now. No, I don't want you to be 55. She says, I want to live with you as long as humanly possible. And I said, darling, Ama, that's my name for grandmother, has invested and doing everything I can with an incredible team led by a company who opened up a window that wasn't open to me before to make that possible. they are aware of Virta and what it has done in my life, that when I arrived in town, my daughter-in-law, bless her heart, their whole kitchen was Virta friendly.
Oh.
My parents' home is Virta friendly. I'm the one who does all the holiday cooking. Everyone eats Virta friendly and no one complains. It's just been incredible. And I feel like I have such a responsibility to share my experience with anyone who cares to listen. I'll have folks who come up who haven't seen me in a little while and say, well, what are you doing? And I say, Virta. What's that? And they said, well, my company cared enough to introduce me to Virta. Let me tell you what it is. And I'm like sort of like a walking commercial, because that's how profound this lifestyle has given me back my strength, my health, my well-being, my joy, energy, boundless energy. And the pounds I lost, that was a side benefit. Getting off insulin, I never thought was possible. And here it is, 2 years in, I'm stronger, and this is my life. There's no turning back.
No more sitting on the sidelines for you. Which is great. And, we talk a lot about, the research, which is critical, and I'm so proud to be a part of. And we talk about, the business aspect, which is critical to, being able to scale and bring this treatment to many people. But at the end of the day, stories like yours, they just, it never gets old. They touch me. And that's what all that background stuff, that's what it's for, is to make these changes for the individuals. And that is wonderful. So Heather, I can't congratulate you on your health victories enough. And I also, in the same respect, can't thank you enough for being here with us today, and joining us and sharing all that with you, with all of us. Wonderful, wonderful stuff. And if you wouldn't mind, and I'll ask Trent if he's still on to come back, and we'll take some questions now from the audience. Let's see. This first one is to Dr. Vora and Heather. Any parting thoughts to the audience from what things that we've talked about today, but maybe didn't cover everything that you would have liked to bring up?
I think, for me, the key is early adoption, engagement with the program, and sustainability. Mm-hmm. And that, as we were doing our due diligence in researching options, that was one of the main areas that I was really probing. I wanted to make sure that the treatment that we offer is safe, first and foremost. Nothing in life, no medication has zero risk. We all understand that, but it has to be significantly safer than other alternatives. It has to be effective, and it has to be sustainable over time. And what I'm really impressed with so far, and I'm looking forward to the 5-year data that is hopefully going to be published soon, of how does a population who is on Virta nutritional therapy management program do over 5 years time. And that's powerful. That's what I'm really excited about.
And what a difference that you have made by being one of those early adopters in the lives of the people whose health you're responsible for. So that's great. Anything else, Heather, from you that I didn't ask?
One thing I would like to share is I'm thankful that I didn't let my fear hold me back from trying something new. After 17 years, you would think, but I'm thankful that I did not let my fear hold me back, because there was that initial and the other thing I wanted to share was learning how to use food as medicine has been like eye-opening, mind-blowing for me. So I thought I knew what my body could break down based on what we were taught our whole lives. Here's a food pyramid. This is what you should eat. Well, I learned that my body doesn't respond to the food pyramid that I've been taught my whole life, and that it's sensitive to some things. And then I learned what those sensitivities were. And I was very patient in the guidance and the encouragement and the assistance I was given through my health coach and doctor and my team at Pequot Healthcare and through the tribal health services. It was a village that helped me. I didn't do this alone. I did my part. So we do have to do our part. But, and a lot of times I'll be asked this question, what about the things that you can't have? Like, is that a negative? And all I can think of is there's certain foods that are like poison to my body. My body doesn't know what to do with them. It doesn't break them down. It'll cause me great illness, high blood sugars, hospitalization even. So now that I know that they are poison to my system, I avoid them. Just like, I wouldn't knowingly pick up something that said poison on it and ingest it. And that's how I have really, truly been able to differentiate what I can have and live a very healthy life of a rich quality. And those foods that I used to have that really did me great harm and would rob me of a life full of quality. And if I could share anything with another individual who may be exploring this lifestyle change, and it is a lifestyle change. You never want to go back. You can see the numbers for yourself. Is have an open mind, take the time, one meal at a time. It's one meal at a time. I never look beyond that point. One meal at a time has brought me to this point 2 years down the road and still going.
Great. I want to thank our esteemed panelists very much for joining us here today, and also everyone who came to listen. And thank you to Shannon, as always, for organizing a wonderful webinar.